It is 8:42. A brand new addiction treatment facility in Indianapolis aims to help people get back on their feet. Our opioid crisis continues to crush our communities, and the pandemic has only made it worse for so many people. Stephanie Anderson is the CEO of Recovery Centers of America, joining us live to answer questions about this brand new facility. Stephanie, good morning. So good to see you. I want to jump right in, though, because this is so new. I want people to know about it. Our opioid problem has not gone away. It's just gone up, and more people are having issues. I want to start there before you tell us about the center and what you're seeing in Indiana as a whole right now.
I think in Indiana, the opioid crisis and really addiction in general has increased, particularly through the pandemic. There was a Gallup poll that said Americans feel their mental health is the worst it's been in 2 decades. And we are definitely seeing that. And people are finding ways to cope and deal with the stress of our reality through substance use. And it's unfortunate. And we're seeing less and less people reaching out and accessing care because of fears related to contracting COVID-19.
All right, so we're going to talk about that and how you keep folks safe. But Recovery Centers of America, the name of you guys. What is different maybe about your facility, or what's the same, and what do you want people to know as far as how can they get hooked up with you?
Well, I think what makes us different is we have looked at every barrier to accessing treatment and accounted for it. So if getting to treatment is a difficulty, we will provide transportation for you to get here. If finances are a difficulty, we have agreements and opportunities to help make sure that your treatment is affordable, and you can have a payment plan that helps you pay whatever out-of-pocket costs may have originally prevented you from coming to treatment. I think what also we do that's different is we look at whole person care. We know that recovery comes in all different forms. And so we provide a lot of auxiliary services in addition to your transition or traditional cognitive behavioral therapies and evidence-based practices. So we have wellness coordinators and yoga instructors and music therapy. It really just takes into account the whole person and what they might need in order to find that pathway for them that works.
Gosh, the facility looks beautiful. I'm looking, or we are looking at the video right now. We have about 45 seconds left. If there's somebody that's watching this morning and, maybe it's their family member that they said, my goodness, my daughter, my son, my dad, my aunt, my cousin, I think that this would be a program for them. What is the first suggestion to try to get them help and to get them into the facility?
Call 1-800-RECOVERY or visit our website. You can reach that 24 hours a day, 7 days a week. We have specialists trained to work with you or your loved one directly and help figure out how we can get somebody into care. As soon as they're ready, we're here for them. 24 hours a day, 7 days a week.
Yeah, we briefly talked in the commercial break that, you guys are getting more and more insurance, companies working with you. And in some cases, people that are watching right now, they may have an insurance that will help pay for this as well.
Absolutely. We are working with commercial insurance to make sure this is affordable. We also have opportunities for scholarship for those that it may not be affordable to. We're really willing to work with the individual to make sure that care is the most primary thing that people are looking at and not the financial barriers to finding recovery.
Stephanie Anderson, thank you so much. Good luck to you all.
Thank you so much.
Yes. For more information, fox59.com/Angela Answers. If you didn't get that hook up there, exactly like how to get to that site, and again, exactly what they're doing there, we'll get you hooked up and hopefully get you or your family member some help. It's 8:46, and Jim